I've seen this stretch, a few times before, and you're bending over, you're holding on to a weight with the arm, and gradually over time, the weight will traction or decompress the arm. This is actually pretty good. Anything that is compressed should be decompressed. Eventually, it's better for it. The fascias and the muscles can get quite wound up. We call this traction, we call it decompression, but it doesn't matter. It's a necessary thing to a tissue that needs it. As always, with any stretch, make sure you do it safely, make sure you do it with the approval of your primary care physician and with supervision. It's very important whenever you're doing anything with a weight, do it with supervision. Now, in a way, I have to say that the arm generally doesn't need decompression. This whole thing doesn't necessarily need this traction motion a lot of the time because it's hanging out all day. It's swinging right beside you. It actually gets a fair amount of decompression. However, the muscle and fascia tension can build quite normally in the body, this compression that we're talking about. Not a nerve compression, but just a general fascial mechanical compression can build quite normally. And that might be from, heavy doors you're pushing on, or you could be doing push-ups because even though it's your body you're lifting, the arm is taking the weight. A bench press or the chest press machine at the gym, they're called a press for a reason, compression presses. But as well, excess muscular tension is equally a possibility. And that muscular tension might be a product of all these other things we just mentioned here, but at the same time, you can have excess muscular tension by excess nerve tone without any of the other things. It might just occur independently of the other problems. They can be related, but they don't have to be. So there's something kind of, let's say, normal standard about all the synovial joints, all of the fluid-based joints. I'm going to make a real generalization here. So if we say this would be a representation of the elbow joint. There'll be a capsule around the joint itself that holds in what we call the synovial fluid. That's all in there. That is a genuine fluid. It's filtered plasma. No big deal, but it's filtered plasma, so it's real. And with any joint, you'll have muscles that are coming from a higher point to attach into a lower point, and they'll be on most sides. I'm just going to draw two here. And then you'll also have muscles going from maybe a slightly higher point to a much lower point, maybe crossing into the hand in this case, just for illustration purposes. And they get this kind of crisscross thing going on here. And now individually when they contract, they create the motions of the arm. So if just one of them contract, maybe you get extension of the arm, maybe you get flexion of the arm, rotation, etc. But should they increase in tone or just increase in fascial restrictions very generally, like the whole thing, what you get is general compression of the joint. You get general compression of what it crosses. So in this case, it's the elbow joint, but it could equally be any joint. And now an interesting thing is this synovial fluid, which we often take for granted, it actually requires intermittent motion, slow fluctuations, sometimes faster, but fluctuations nonetheless. It requires constant fluctuations, high and low pressures, to remain optimally perfused. That might be the wrong word. Just the right amount of fluid. To get the right amount of optimal fluid in the joint, you have to have movement. And this is true, again, of all synovial joints. So starting with the wrist. Wrist is, again, a synovial joint. And this is, types we're not going to get into, but they're all synovial joints. Right down into the fingers, too. Like all the way. Let's not go overboard. And there'll be some important muscles, as always, crossing them. So in this case, we have our flexor and extensor compartments, our thenar and hypothenar, and these cross all the way into the fingers. And so you can see multiple muscles, multiple layers of muscles crossing over that wrist joint. The elbow joint, and we could throw in the radial ulnar joints if you want to. There you go, there's one. Missed the one at the bottom, but that's okay. And then there's the proper elbow joint. And they, of course, have the bicep and tricep muscles covering them, the pink at the front and the blue in the back. And because they crisscross, again, we're getting this crisscross effect with the forearm muscles along with the bicep, tricep, general tension builds compression, changes pressure on the joint, changes fluidity and muscle tension. Shoulder joint, of course, has a synovial fluid. That's everyone's favorite. Everyone's favorite to injure, it seems. But as well, it's got a number of different muscles, tons of muscles. In fact, I'm not going to bother even trying naming them because there's more than enough. And so all of these muscles working as a whole are very much capable when they contract, and they all can, of reversing the normal decompressive effects of the arm and adding to general compression of the same thing. It doesn't stop there, actually, because there is a neat neurovascular bundle that runs from the cervical spine area and the first rib all the way underneath that clavicle. So you can have what will be the subclavian when it goes under the clavicle. There we go. That's the subclavian, and it's going to be the artery and vein. I'm just going to draw one for clarity's sake. And as well, at the same time, we have our cervical brachial plexus. That's the nerves from the cervical spine, and they're wrapping around that, and they're going down, and they're all going to go to the muscle of the arm. This is what's going to supply that whole arm. Supply, drain, supply with nerves. And then, last but not least, we have our associated lymphatics of that area, and they're all over. And so this is an important structure, and just based on the fact that it is behind the clavicle and running over the ribs, this kind of a position actually helps to bring the clavicle off that area. That neurovascular bundle, again, just to really simplify, would be coming right through here, right in behind that clavicle, which would be give or take right about there. So as we start to traction out that arm, we pull that arm down, and depending on our position with our body, if we drop a little bit more into flexion, we can pull it forward. We can actually make a little bit of extra space for that neurovascular bundle. And so this is why it can be very beneficial to spend a little bit of time tractioning out the arm. It's always best to go lightly and slowly. Keep that in mind. More is not better. And this is especially so when it comes to already irritated tissue. This has been Elge and Simple Lines Anatomy. You have a good one now.